Hi, welcome to the training session on how to use MetahOS on Swasti Convox. So to begin with, I will show you how to log in on both the platforms simultaneously. So here, I will log on as an agent into the Swasti platform. To do this, I'll enter the username, password, and station number. When I've logged in, I'll click on Ready. Similarly, on MetahOS, I have already logged in. Here, it is important to note that both the user IDs should be the same. Once I have logged in on Swasti, I will see this dashboard. Now, we're going to see a situation in which the nurse is getting a call from the patient. So now the patient has called me. I have answered the call, and I can see the M16 CRM is on the Swasti Convox screen. So now I go to the green button here, which says New Screening. When I click on New Screening, I see the list of patients that are associated with the mobile number that has called me. Here I can see that Sharon is the patient who has called me. So I can select Sharon. After selecting Sharon as the patient, I'll select the camp. For this training, I'll select Telecare as the camp. After making these selections, I'll click on the blue Next button. Once I've clicked on the button, this form will appear. I have patient Sharon on the line with me. So I'm going to ask him about the questions that are mentioned in the form. Hi, Sharon, are you there?
Yeah, I know.
Okay. So the first question on the form is that is anyone in your family experiencing any symptoms right now? So Sharon, is anyone in your family experiencing shortness of breath, chest pain or pressure, drowsiness, coloration of lips, vomiting, blood in sputum, or any other symptom?
Yeah, chest in pain.
Okay. So since Sharon told me that he's facing chest pain, if somebody in this family is experiencing chest pain, I'm just going to make that selection. If Sharon says that he has some other symptom, then I have a text box for him to enter those symptoms as well. Sharon, out of these reasons, why do you think you're calling? So are you calling for medical reasons, social protection reasons, counseling reasons, or are you just curious, or do you want to follow up?
I'm calling for medical reason.
Okay, thanks, Sharon. So I'll make that entry as well. So since Sharon selected chest pain or pressure as being one of the symptoms that he is facing, so I get a notification here saying that I should connect to ERT and end this call. For the purpose of this demo, I'm not going to end this call, and I'm going to continue with the other fields that we have. So once I know that Sharon has called for medical reasons, I'm going to ask him some of the medical questions. So Sharon, how has your health been? Have you been feeling any of the following symptoms over the past week? Do you have a sore throat or cough or running nose, loose stools, loss of smell, fever, headache, or weakness?
Yeah, headache.
Thanks. Since Sharon is male, I am not going to ask him whether he's pregnant, but then I will move on to the next question, which is whether Sharon has been advised by the doctor to take medicine every day for any condition. Sharon, has the doctor said that?
No.
No. Okay, so I'm going to choose no based on Sharon's response. Sharon, what is your COVID test result?
It was negative.
Negative, right. So now I'm going to click on negative based on what Sharon has suggested. And we have another field for HOPI that we will not be addressing right now. So once all of this information has been collected, we move on to the next section on vaccination. Sharan, have you had your vaccination?
Yes.
And what vaccine have you taken?
So it was Pfizer.
Okay, so Pfizer is not on the list, so we only have Covishield and Covaxin. Out of these two, I mean, so if it is others, then we will have to add that. But say Covaxin for now, we'll just work with that.
Sure.
Do you remember the date of your first dose of vaccination?
Yeah. 14th September.
14th September. September 14th, right? And you haven't taken your second dose yet, I'm guessing.
No, I have not taken.
Thanks. So once I've filled in all of this information, I'm going to click on the next button. Based on the responses that Sharan has shared with me, the form says that Sharan is a low risk patient. If I have a feeling that Sharan is a high risk patient, then I can modify that. And I get an alert saying, are you sure? Do you want to modify the system calculated risk? And if I want to proceed with my assumption that the risk is different, then I will change the risk level from low to high. Once the changes are made, I'll click on the save button. Now, Sharan's updated record has been successfully created. Okay, so with that, I will proceed to the next tab, which is CRM. Now I'll choose the disposition. So this is a test call. There would be in the real world, there would be other dispositions as well. And then I have an option of selecting the sub dispositions and the sub dispositions. In case I want to transfer this call to any other agent, I also have the option of doing that. And after making these entries, I end this call. So thanks, Sharan. I'm going to end this call now.
Sure. Thank you.
Thanks. So this was a brief demo of how to use MetahOS in Convox Swasti. Thank you for watching.